Hey, Dr. Fass, how are you?
Great.
Hey, I just wanted to ask you a few questions about MD Logic. How long have you used MD Logic?
Oh, I think past 10 years, at least 10 years.
Okay.
Yeah.
Just tell me about it. How's it impacted your practice? How's it impacted you personally?
Well, MD Logic has really has given me the opportunity to continue on to continue to be productive in my practice, and I've been able to adapt the product to suit my particular needs and facilitate what I like to do, and it's worked at every stage of the development and my development as a physician, and I expect that it'll continue to help me in increasing my productivity and producing a very quality product.
When you're doing your notes, are you able to do them in the exam room?
Well, my note is really created by several factors. One is I've been using and have fully integrated the kiosk into collection of data, which is deposited and populates the note. I have my staff does history of present illness. I have my buttons so aligned and created to make it very, very simple. So by the time I get into the room, the history of present illness is done in a basic form.
Mm-hmm.
The past medical history, surgical history, and family history is all populated, and I do review those. If there's any problems or positives, I go back and ask the patient about them. And I really spend my good time in the room talking to the patient directly. And after that happens, I really have a very good idea where I'm going with the patient. I really don't go near the computer in my examining room until the patient is left and I've completed my exam. And then I populate my physical findings.
How long does it take to do that at the end of your exam?
Not even a couple of 3 minutes.
Okay.
It's very simple.
Are you sending letters out to primary care doctors?
Oh, absolutely. Every note that I create on every patient automatically goes out to the referring doctor.
How do your patients feel about MD Logic?
Well, I don't know what they feel about MD Logic, but I'm certainly impressed with the level of interest that our office has in it, and they feel it's a very modern addition and up-to-date addition to our office practice.
Are they using a iPad for kiosk?
Yeah.
Okay.
Yeah. I think that part of it is going to work out very well. We're just about at the end of doing our third iteration of the iPad and the intake that we want, and we think it's going to work out great with really very minimal input from me as the physician. And that's what I think is important.
As far as billing's concerned, are you using a billing service?
I use a billing service, but they tap into my charge ticket that I create, or that's automatically created in MD Logic.
Does this help get rid of your undercoding for E&M codes?
There's no question about it. I think that was the first thing that attracted me to the software, is that at the end of my interview, process, exam, and assessment of the patient, I can then evaluate the relationship between my effort, my documentation, and the billing code, and I can reconcile them, and the software helps you reconcile them. So that was really the initial interest I had when I purchased the software.
Has it eliminated all your transcription costs?
I have none.
Okay.
And no homework.
There you go.
That's even better.
You're able to leave after the last patient's seen with everything completed?
Yeah, I don't have any homework anymore.
There you go.
None whatsoever.
Could you ever stop using MD Logic?
Will I ever stop using it?
Yeah.
No way. It's done several things for me. It's organized my chart. I have very easy access to information within the chart at the time of the visit. It's helped me be a very productive physician. And I think I'm delivering a high level of care to my patients with the help of the computer system. Billing is not a problem anymore. My letters go out to my referring doctors and they're complete. They go out immediately. So, no, it's really made me a better doctor.
Let me ask you, going paperless, how's that been? Getting rid of your charts?
Well, I'm down. I'm sure I've saved several full-time employees. There's absolutely no paper in my office, none. So that makes you very efficient within the administrative function of the office.
How do you like using touchscreen as far as your input?
Can't use a touchscreen.
Okay.
Because I have a problem with my neck and shoulders, which a lot of ear, nose, and throat guys do.
Yeah.
They have that kind of problem. So I use a mouse. It seems like it's physically better for me. But my staff uses touchscreen.
Okay, and then your patients are on the iPad as well?
Yes, they're on the iPad. Right.
Okay. Well, I appreciate your time and appreciate your business.
Great.
Thank you.
Yeah.